a Fleet enema, which you can buy at CVS, right? Anybody can use a Fleet enema. It's small. They can be either just saline or just tap water. They come pre-lubricated, so when you peel the top off, the lubrication's already on there. It can be self-inserted into your rectum, and you just squeeze until all the fluid is out of the Fleet enema. These are used in the hospital as well. Sometimes they'll order a Fleet enema, but most of the time they're gonna order a regular regular enema. Okay, so this is a Fleet you can play with, and if you've never seen one of those before. This is one of many enema bag kits. And again, every facility has different kinds. So you're gonna open your kit, and the doctor's either going to order a tap water enema or a soap suds enema. Soap suds are kind of a thing of the past, but sometimes they still order soap suds. So in your kit, you always are gonna have a pad front of the patient with a plastic side that goes down. You don't want the plastic side against the patient, plastic side down, right front of their bottom. You're going to have a packet of soap, Castile soap, that you can use if it's a soap side. If it's not, you throw this in the trash, okay? And then you're gonna have your enema bag. Now, when you open your enema bag, your clamp is gonna be open. So the first thing you gotta do is close the clamp, because you start filling this bag and the water's gonna go everywhere. So close your clamp, okay? Again, it's a pre-lubed tip, but I always recommend when you're gonna give an enema, you take in another package of lube, because there ain't never enough. I don't care who you are, right? So a little extra doesn't hurt. So here's your bag. It holds, you can see on the side, and you can use this for measurements because what goes in is going to come out. You don't need this for I know, but you can see it's 500, 1,000, and 1,500 mLs. So, and then full would be 2 liters. So 500, a liter and a half, 2. It has opening at the top for your fingers or for the pole. Okay. And it has the plastic at the top that you again, you need to be practicing this. That you can squeeze to open. And it's hard. I don't know if it's... You squeeze it to open to fill it. Okay? So you close your clamp, you bring it to the sink. If you need soap, you put that in. If it's a soap side, if not, you just fill it with your water. You're gonna have a pole at the patient bedside, and you're gonna hang it on the pole. Okay? You can do additional lube here if you need to. What position are we gonna use for these enemas?
Left lateral.
Left lateral sims, you need to know that. Left lateral sims for anything rectal. So positioning your patient. If it's Grandma Betty and she doesn't get around too much, you might want to have a bedpan handy, right? If it's a young person who can get themselves up to the bathroom, you're going to ask every patient to hold this enema as long as they can. A younger person obviously will be able to hold it longer than Grandma Betty will be able to do that. You may want a bedside commode for the patient. You're gonna have to figure all that out based on your patient and the conversation you have with them before you start. Do I need a bedpan? Do I need a bedside commode? Are you able to get to the bathroom, etc.? Okay, so you have all that conversation, you get them positioned, put the pad under the bottom, get ready. You have clean gloves, nothing sterile about any of this. Clean gloves you can put on now. You didn't need them earlier, put them on now. You're going to lift, which butt cheek's gonna be up in the air?
Furthest.
Right, the right buttocks. You're gonna lift the right buttocks cheek so you can have a clear view of the rectum. You are going to insert, take the cap off, and you are going to insert. Oh, one thing I didn't do, I didn't prime this tubing because I was talking. So once you have the bag full, you want to make sure to get the air out of the tubing just like you would with an IV. Okay, so you just make sure it's out and then clamp it. Okay, not that the air in the colon isn't gonna kill somebody like an air embolus might in their vein, but. Okay, so positioning, you have the pad under the patient, you got the bedpan handy if you need it, or the bedside commode. And you are going to take the cap off, you got clean gloves on. You are going to insert the Foley, and there is a specific distance in your book. I don't remember what it is.
3 to 4.
If it's 4 to 6 inches, 3 to 4. Okay, there's a specific number. I don't test on it because everybody's different. If they are impacted, what does impacted mean? Constipated, right? They can't pass any stool. A lot of times I will insert, I mean, I'm not gonna go, you know, 1.5 feet, but I will insert until I can feel that impaction. And back up a little bit. That's just practice. That's not an NCLEX answer. Don't ever answer a question because Professor Matthews said push it in until you feel the impaction. But that's just what I do. So, oh, there it is. And back up just a little bit, okay? You're gonna open the clamp, and there's really no happy medium. Like a roller clamp on an IV, no, it's either open or closed. So you're gonna open it, and you're going to assess the patient with your eyes, right? Inspection, keeping your eye on that patient. If they start getting antsy, right, and they're like, oh, I can't do this, right, clamp it off. You don't remove it, you just clamp it and ask them to breathe, right? You wanna hold the enema where it is, and you don't wanna take it out. Tell them take a deep breath, we're gonna pause for a minute, right? You're gonna start it again.